Can you see by the dawn's early light what so proudly we hailed at the twilight's last gleam, whose broad stripes and bright stars through the perilous fight, oh Lord, oh the fight, oh the ramparts we walked were so gallantly, yeah, and the rocket red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does thy star-spangled banner yet wave? Oh, land of the free and the home of God, home of the brave.
Good afternoon, Christine Platt. How are you today?
I am doing great. How are you?
I'm excellent. I am so pleased to see you and to have this conversation with you. And
Same, same.
so I do want to go ahead and I want to get right into it. You know,
All right.
this conversation, and I reached out to you because I'm in charge of our Black History Month program, as
Mm,
well as the No Place for Hate campaign at our school.
wonderful.
And so once I had that in my mind that I was going to combine the two, I immediately thought of you, and I just thought that you would be somebody that our children truly need to hear from.
Wonderful. Well, I am honored, and I know you have a number of amazing scholars at your school, so super excited to connect with you all and share whatever bit of advice I can with them.
All right, so you know what? Let's kind of start off with a little introduction, if you don't mind. Tell us who you are. Uh, Tell us what role, what you do,
Mhm.
because you do a bunch,
I
and
do
and
that.
you do a lot. You are. I was on your website, and you truly are a Renaissance woman.
Oh, well, thank you. Thank
Yeah.
you. Yeah, I do a lot. So I am Christine Platt. I am a historian and also an author. And I also work as the managing director of the Anti-Racist Research and Policy Center at American University. So, and I'm also a lawyer. It's a lot.
You definitely said a mouthful. Yes. Can you tell me a little bit about what you do for for your job at American uh, Research?
Yeah, sure, sure. So, as the managing director of the Anti-Racist Research and Policy Center, a lot of what I do centers around mostly amplifying the voices of scholars at our university that study the many different intersections of race and racism, right? And so, for example, when I say intersections, it could be there is a scholar who works on racism in the environment, right? And then there may be another scholar who focuses on racism and gender equity in sports, right? And so, yeah, we have a number of wonderful scholars at AU who are just doing amazing work and amazing things. And then we also like work with the public. We also work with different schools, just, local community organizations. It's a lot of work, but it's a lot of fun. It's a lot of fun. And it's a way to, really feel like I'm contributing to this very important work, which is, making sure that our world is more diverse, equitable, and inclusive. So yeah, that's my role at the center.
I love it because now you know what? It's a perfect segue into my next questions. What? Because you threw out a couple of words. You use the word diversity. You use the word equity. What
Mhm.
does equity, diversity, and inclusion mean to you?
I think it's so for me, and it's going to be very different because I am a historian, right? I've studied our history, which means I've had to study world history. And I think when I think of diversity, equity, and inclusion, it's always interesting for me to like flip that question around to people because and also I do that to get people to more so understand how easy it is to have different ideas of what diversity, equity, and inclusion mean, right? For me, it can all be one word, right? Or even one sort of theme, which is, I mean, just having us acknowledge our shared humanity, right? Acknowledge and accept our shared humanity as people existing on this planet, right? But other people may have given you, well, diversity is this, and equity is this, right? And inclusion is this, right? And so for me, the three can't, they're just not mutually exclusive, right? Like they have to exist together. right?
And
And so, but I won't flip it back on you or your scholars since we can't, do that virtually. But yeah, for me, it's, it's as simple as, and I feel the same way about anti-racism work, right? It's acknowledging our shared humanity and serving as leaders and allies in spaces where we have the power to bring that about, to bring about and show our collective shared humanity. So that's what it means to me.
all right, so let's kind of take it a little step further. Why is it necessary or important for to have equity, diversity, inclusion, within, let's say, within literature, or within academia?
Yeah. I mean, I think it's such an interesting question because I can't even acknowledge a world, at least the type of world that we hope to see, without it being in every possible aspect and area of our lives, right? When we talk about literature, we talk about books as being windows and mirrors and sliding glass doors. And I think that that's an example that can be applicable to almost any sector, right? And so the reason we call certain books mirror books is, and I write mirror books, let me say that. So I write for Black and Brown children, and they serve as mirrors because they allow children who are Black and Brown to see themselves reflected on the page, to see their lived and shared experiences, right? But then also understanding that those books serve as windows for other children, right? And so if you are reading a window book, you are reading about someone else's life and history and culture that is different from your own. And so we like to say this is a way for you to get a peek into someone else's life, like you're peeking through the window, right? But then literature also serves as sliding glass doors, right?
Mm,
Where you are able to slide that door back and step into the shoes of someone else's reality and lived experiences. And I think that's key for building empathy, which is a big
yes,
part when we talk
yes,
about anti-racism work and DEI and no place for hate, right? Really that shared humanity, acknowledging our shared humanity, is learning to have empathy for others. And you can't really do that unless you are fully aware of what their lived experiences are like.
absolutely. No, I totally agree. It allows us the opportunity to step in those other people's shoes, and for that moment when we're reading, to experience what they're experiencing. So absolutely, yes, absolutely, absolutely.
Hmm.
Why did you become an author? And you know what? Hold on. Let's take a step back. What are some of the books that you have written?
I don't think we have enough time. I don't think we have
Well,
enough
give
time.
give us a couple of the books that you.
It's actually interesting because once you become an author, that's really the hardest part of your job, is finding time to read, right? And one of the things that makes you a good writer is you're a good reader, right? Because again, it's going back to these lived experiences and now also like learning the craft of storytelling. And so unfortunately, I don't even get a chance to read as much as I used to. But I do a lot of audiobooks. That has been really helpful. And right now, I'm kind of focused on Toni Morrison's The Source of Self-Regard. It's a collection of her essays and speeches, and it's just beautiful. And it's almost like this gift, I feel, that gift of guidance that she left for people of the African diaspora. Um, but yeah, and I mean, I can go right into why I became an author is because I love reading, and I always loved reading. Um, but I didn't know, at least when I was younger, that this was a viable career path for me. Like I never, which is why I love going to schools and talking to especially really young children, because they're like, "Ah, you wrote my book," right? But I'd never seen or met an author in person. So it wasn't even Like it wasn't even something I considered. And it was when I was working as a senior policy advisor at the Department of Energy that I had an opportunity to participate in National Novel Writing Month. And it reawakened my love for storytelling. And so that first novel, it was the book that just like really changed the trajectory of my life. And now ooh, I've written almost 3 dozen books, which is
Mm.
amazing. Yeah, most of those are children's literature.
Was the first book that you wrote The Truth About a Witty?
Yes, that was the first book, and it was a historical fantasy about a restless slave spirit wreaking havoc. I know, right? It's so funny to go from that to writing Anna and Andrew, but storytelling is storytelling.
I really do appreciate your Anne and Andrew books.
Thank you.
When I was in college at USF,
Mhm.
College of Education, one of the classes we took, we had to write a children's book,
Mm,
and I created a children's book, and it was one of those. It was an experience that I truly enjoyed
mhm.
um, doing at that time, and when you're doing it and you're amongst it, I saw myself possibly writing some children's books
Okay. Okay.
using poetry. Uh,
Hmm.
However, life takes us different paths, but
Uh-huh.
I truly do appreciate the Anna and Andrew books, especially. Well, all of them are awesome, but the one that I really enjoyed was the one about the African American Museum. Their trip
Yes.
to the African American Museum. I thought that
Yeah.
was
Thank
fantastic.
you. Thank you. And that was actually the very first book that I wrote in that series.
Ah,
And it took me months. And now that let's see, I think we're on book 16. I can
hmm.
literally like write them in an afternoon because I like know the characters and I know the
The
storyline and I know the
structure.
structure. Yeah. But that first one took me a really long time. And I'll never forget like just seeing the illustrations because I don't do the illustrations. It was my first children's book, so it's not like I was consulted
Oh no,
about no, no.
oh,
And so my biggest thing was that I really wanted them to be noticeably African American children. I did not want them to be racially ambiguous. I wanted this to be a series that was about African American families, right? And tried to make it as inclusive as possible. As you know, we have one parent that's from the Caribbean and one parent who is, American born. And so that's a very real reality of, people of the African diaspora who live in the United States. So yeah, I love them. And I'll just never forget seeing those illustrations and preparing myself. Oh, I was ready to go like bat to bat. And they, showed me this illustration of these beautiful chocolate characters. And I was like, oh my, I like lost my mind. Like I love them. The curls, the flyaways, those things are so important to see, especially for early readers. When it's the first time, I just imagine like, what if I had a book like that? And I'm like seeing myself on the page, learning my history, and learning my history in a way that's joyful and, something that I can be proud of. I can't imagine, how my life might have been different.
love it, love it. So, we're talking about some positives right there. Let's kind of switch gears a little bit.
Mhm.
Have you ever experienced bigotry or racism while working in the world of literature as an author, or
Oh,
maybe just in your professional
I mean,
career?
I feel like people of color like experience it every day, right? So it's not sort of these siloed, isolated, like racism only happens when I go to class, or racism only happens when I go to, the store, right? Like it is unfortunately something that is so woven into the culture of our society. That is something that we experience every day, sometimes knowingly, sometimes unknowingly, right? sometimes we have come to just expect certain behaviors, right? So we're not surprised, or we come to anticipate certain behaviors, right? Because that's how woven it is in the fabric of our culture. And I think about living here in Washington D.C., which is known as Chocolate City, although it's a lot of white chocolate in Chocolate City these days, but it's still a predominantly Black area, and just how beautiful and wonderful it is to just exist among my people, right? But I know the further I head south, right? I know, like, I drove my daughter to South Carolina recently, and I mean, you see it, you feel it, and I just know, like, the further I go south, there are just certain things that I've sadly come to expect from the behaviors of others. So yeah, I mean, I experience it every day.
So how do you deal with the negativity, or better yet, not let it get in your way of progress?
Yeah, I mean, I think that is also part of the work, right? I mean, I look at my life and what has been able to and just what has changed. And it's not like I'm 100 years old, you know what I mean? Like I'm not even 50 years old, and to see what has happened in my lifetime, and to look at some of the progress that has been made through a historical lens, I can see change, right? Like, I can see the trajectory of a lot of change, not just in policies, but also in attitudes and behaviors in this country. And so I feel like um that is what just keeps me positive about the work, right? I mean, I think about different, like, training sessions and things that I've done, and I'll get asked this question because people feel like nothing is happening, nothing is changing, right? And it's like, the fact that we're sitting in this room together, you know, all different races, nationalities, and genders, and we are literally having a facilitated conversation and discussion about race, and we're crying and we're telling our families' histories and all these things, that would have never happened.
Yeah, we're at a place where we can have these uncomfortable conversations with each other
Hmm.
and hope, and still feel safe for the
Yeah.
most part.
Yeah. And part of the uncomfortableness is change and growth. And I try and get people to understand that. I'm like, you want all this change and all these things to happen, but you also don't want to be uncomfortable. And it's just not possible. Like, you have to pick.
That's
you
correct.
know like, you can't, having these conversations are uncomfortable, right? Challenging lawmakers and the police, that's uncomfortable, it's uncomfortable, but this is how change happens and has always happened. And you can look at it historically. There have never been any fundamental, monumental changes in the history of our world without it being uncomfortable conflict.
How does it make you feel when you hear young people say they don't like to read, especially considering it wasn't that long ago that it was against the law for
Hmm.
Blacks and for slaves to learn how to read and write?
Hmm.
How does that make you feel when you hear about stuff like that?
I For me, it makes me just want to put the right books in their hands. Like, I don't feel
Uh,
sad. I don't feel like, oh my God, how could you not want to read like that? Like, that's not a conversation that I ever have with young people. What I believe is, young people who don't like to read have not had an opportunity to have the right mirror books in their hands, right? And so this is why it's so important for me to write for early readers, because that is where that love for reading and this fundamental, like, oh my gosh, I can't wait to read a story, that's where that comes from, right? And so, yeah, if your childhood was filled with books and stories and experience that looked nothing like you probably got bored at some point and didn't want to and didn't want to read those books, right? And
yeah.
so, what I like to do, if a young person ever tells me that, is I'll say, well, let me make a recommendation.
Okay.
right? And you read this book, and after you read this book, you tell me if you still don't like to read. And it's never happened, right? Because now there's so much diverse literature, not only early readers, but also middle grade and also YA, right? Where I mean, there's so many opportunities and ways for me to get people to understand that their lack of love for reading has nothing to do with them, being challenged by the English language or, or anything like that. It's like you just weren't given the right stories growing up. But that's something that can be changed at any time in your life. So,
I like that outlook. Absolutely. Couple of more questions, if you don't mind. So I want to go back to No Place for Hate because I
mhm.
do know you work with that program, and but why do you think it's necessary for programs like No Place to Hate um, to exist in society today?
Yeah, I mean, believe it or not, this is like a movement of young people, right? Like these are young people saying like, yo, we need something, and we want something implemented at our school. We want something implemented in our town, right? So it's so funny to think that a lot of, adults, we assume that like this work is being forced upon children, but like young people want to do this work, right? And No Place for Hate is an opportunity for those schools and classrooms who really want to bring about change within their school community to have a guided, structured way to do that, right? And I think that's really important, right? Because so many times we hear people, they want to bring about change or they want to do something, and they're just like, but I don't know where to start, right? And so initiatives like No Place for Hate, that's why it's so important. It tells you how to start, it tells you what to do, it tells you how to maintain, right? There are activities, there are, so I mean, I think all of those types of initiatives and programming, I think it's so important because it's structured and tailored in a way to really help people gain an understanding of, when we were talking earlier about anti-racism and DEI and all these things, it really helps people get a deeper understanding. Um, and it helps control misinformation, which is probably the biggest thing, which is difficult in this work, right? And so, the Anti-Defamation League has been around for a long time. They are a wonderful, celebrated, respected organization, and they know this work, right? And so, again, having an initiative like No Place for Hate means now there are parents and educators and students that don't have to go to Google and type in, how do I change, the culture of the community at my school, right? Like now they can be a part of this initiative, and also meet with other students and educators who are doing this work. It's amazing. It's an amazing program.
Yeah, I agree. And what I realize about this, well, actually, I guess it's always been like this. The power is in the voice of the young people.
Hmm.
They've always held that power.
Hmm.
Even obviously it was before our time, but even in the civil rights era of the 50s and the 60s, it was a lot of college age students.
Hmm.
They're brave and their voices, they demanded that their voices were heard. And I do see some similarities with this new generation,
Hmm.
especially with social media.
Hmm.
Um, they're savvy, they're tech savvy, and they're getting their voices heard and they're getting it out there.
Yeah. Yeah.
It's,
And I mean, I love the way people, especially young people, have mass mobilized on our social media platforms to collectively do this work. From TikTok to, Instagram, right? But then also like thinking about how, our allies now can be global with social media, right? So I
absolutely.
was just thinking about I know you remember Black Lives Matter was being challenged, when we were doing the black squares and all this and that. And so as more people tried to like use that Black Lives Matter hashtag, trolls started to like also use it, right?
Mhm.
And I don't know if you're familiar with the like BTS fan uh fandom in Asia, but they are Korean pop groups are like it, right? Like how we
Okay.
thought about Michael Jackson,
Yes.
growing up, that is like them with Korean pop groups. And so they heard that this was happening because, they follow, trends and different things on social media. And they like just mass mobilized and like was using this hashtag to just like promote and amplify all of these voices. It was amazing. It was amazing. And so that's the other thing with technology and social media and young people being so tech savvy and just brilliant in some of the things that they come up with, right? It's a way to just further expand this work from beyond our classrooms and beyond our homes, and then just within our church, right? Like we now can like move outside of our community and even
Yeah.
globally, share these stories and experiences and also be allies for others.
Absolutely. So now, Christine, we are actually coming to the end. So I'm going to ask you two last questions.
Okay.
What does Black history mean to you? That's kind of loaded. But what does Black History Month mean to you? And
Uh,
and do you have any parting words for my lovely students here at Falcon Cove Middle School?
all right. Well, first, Black History Month. I think it is a beautiful thing for our society to acknowledge our history 1 month out the year, right? The shortest month out the year, but I'm not being petty. However, for me, Black history is like so much more than just February, right? Um, I think it's a wonderful, much like Women's History Month, and other celebrated, I guess months that are designated to certain cultures and topics and, medical conditions, like everything, right? Like it's a way to bring awareness, right?
To
And so,
highlight.
yeah, so I like that. But to think that that is the only month that we can learn about and celebrate our history um, is absolutely not my take on it. Our history is so beautiful and so vast and so wonderful. And I like to call it, the history of the African diaspora because we extend, throughout the Caribbean, here in the States and Canada, right? Like it's this whole diaspora of people who are descendants of, the greatest civilization, in my opinion, on Earth, right? And so I think there's never enough for us to learn about Black history. And so, although I, admire and acknowledge, the folks who got, Black History Month on the books. Please don't think that that's the only time that we can, celebrate and learn about our history. And then parting words for your students. I mean, first of all, I'm so sorry that I couldn't be there in person. I would love to meet you all. I have heard just such wonderful things. I'm super excited that you are working to receive your No Place for Hate school designation, and super hopeful that once you do, I will be one of your facilitators for sessions because I am a facilitator for No Place for Hate. So we'll have to work on that, Mr. Johnson. But yeah, I mean, just keep going, right? I mean, if there's anything that adults have come to admire about young people during, especially this year during the pandemic, is just your resiliency and tenacity and the way that you have leaned in and embraced a very, very uncomfortable, hard, and challenging time is just very admirable. You just have to know that there are a lot of adults that are unable to do what you all are doing right now. So I just want to encourage you. I want to say that I look forward to hopefully meeting with you all in the coming months. And yeah, maybe I'll send you some books. Should I send you some books, Mr. Johnson?
Oh, I'm not going to say no. I love that. So, guy, I so want to thank you, Christine Platt, my friend of,
Yes.
man, almost 25 years. I met you in,
Don't tell the folks how old we are. We're
I met you
25. What are you talking
summer
about? 25.
1995. It is such a pleasure to see you. Thank you so much.
You.
And I look forward to having some more conversations like this.
Yes, you too. Take care, everyone. Bye.
Bye.
Let America be America again. Let it be the dream it used to be. Let it be the pioneer on the plain, seeking a home where he himself is free. America never was America to me. Let America be the dream the dreamers dreamed. Let it be that great, strong land of love where never kings convine nor tyrants scheme, that any man be crushed by one above. It never was America to me. Oh, let my land be a land where liberty is crowned with no false patriotic wrath, but opportunity is real and life is free and equality is in the air we breathe. There's never been equality for me, nor freedom in this homeland of the free. Say, who are you that mumbles in the dark? And who are you that draws your veil across the stars? I am the poor white, folded and pushed apart, and I am the Negro bearing slavery's scars. I am the red man, driven from the land, and I am the immigrant, clutching the hope I seek, and finding only the same old stupid plan of dog eating dog and mighty crush the weak. I am the young man, full of strength and hope, tangled in that ancient endless chain of profit, power, gain, and grab of land, grab of the gold, grab of ways of satisfying need, of work the men, of take the pay, of owning everything for one's own greed. I am the farmer, bondsman to the soil, and I am the worker, sold to the machine. I am the Negro, servant to you all, and I am the people, humble, hungry, mean. Hungry, yet today, despite the dream, beaten today. Oh, pioneers! I'm the man who never got ahead, the poorest worker bartered through the years. Yet I'm the only one who dreamt our basic dream. In the old world, while still a serf of kings, who dreamt a dream so strong, so brave, so true. Yet even its mighty daring signs in every brick and stone, in every furrow turn, that's made America the land it has become. Oh, I'm the man who sailed those early seas in search of what I meant to be my home. For I'm the one who left dark Ireland's shores and Poland's plain and England's grassy lay. And torn from black Africa's strand, I come to build a homeland of the free. The free? Who said the free? Not me. Surely not me. The millions on relief today. The millions shot down when we strike. The millions who have nothing for our pay. For all the dreams we've dreamed, and all the songs we've sung, and all the hopes we've held, and all the flags we've hung. The millions who have nothing for our pay, except the dream that is almost dead today. Oh, let America be America again, the land that never has been yet, and yet must be, the land where every man is free. The land that's mine, the poor man's, Indians, Negroes, me, who made America, whose sweat and blood, whose faith and pain, whose hand at the foundry, whose plow in the rain, must bring back our mighty dream again. Sure, call me an ugly name if you choose, but the seal of freedom does not stain. From those who live like leeches on people's lives, we must take back our land again. America. Oh yes, I say it plain. America never was America to me. And yet I swear this oath, America will be. Out of the rack and ruin of her gangster death, the rape and rot of graft, and the steal and lies, we the people must redeem. The land, the mines, the plants, the rivers, the mountains, and the endless plain, all the stretch of these great green states, and make America again. Thank you.
Every single person on this planet was placed on this planet the same way as me and you. We live on the same earth, breathe the same air, and when we look up, we see the same sky. In a sense, we're all equal. So why are we still struggling to achieve equality today? From the civil rights movement in the 50s and 60s to the women's rights movement in the 60s and 70s, marginalized groups have always had to fight for their rights before the world, or even their own country, views them as equal. Coming as far as we have in this day and age, you'd expect for differences to be embraced, not shunned, and for everyone to foster love and kindness instead of fear and hate. You and I sadly know that this could not be further from the truth. Prejudice, racism, sexism, and xenophobia are just a few of the many plagues that have spread across the world today. So whatever happened to bleeding the same blood, being in the same boat, or walking the same walk in life? You're not born with this idea that some are superior or inferior to you, or vice versa. The environments people grow up in set off certain triggers, causing us to behave in certain ways. Basically meaning the way we grow up gives us a guide on how to act and respond. For instance, if your family always had a certain news channel on in the background, your opinions are likely to be influenced by what you heard and saw. This is called your unconscious bias. It's a social stereotype about certain groups of people that individuals form outside their own conscious awareness. Basically meaning our brains didn't form this opinion on purpose, but instead retained all this information and came to a conclusion based on it. This gives way to inequality. We form opinions and place some on a pedestal more often than not because of our unconscious bias. Studies have shown that bias is alive and has been since the ancient times. The Proceedings of the National Academy of Sciences of the United States of America has conducted a study in which an entrepreneur pitches an idea. They had men and women pitch the exact same idea, and saw when a male voice pitched the venture, 68% of participants thought it was worthy of funding, compared to only 32% of participants when pitched by a female voice. This shows the truth that, contrary to popular belief, gender bias is alive and thriving, even though women have all the same legal rights as men and workplace discrimination based on gender is illegal. The thing is, inequality is everywhere, and we all agree on the basis that it's a disease. Not everyone has agreed about its cure, though, because equality is not just one idea. It's subjective to everyone. The blurry nature of equality makes it hard to solve dilemmas from instinct. No proposition is perfect. Each contains hidden dangers that emerge with time. Many people, in choosing who gets what, turn to the basis of necessity, the idea that our first priority should be the equal attainment of crucial needs. What feels like a necessity to some is a luxury to others. When trying to divide goods equivalently, the head fights the gut. Problems within the solution can't drown out the moral law within. It's hard to go against instinct, but how are some ways we can try? First, try to identify and understand your unconscious biases, which can be difficult given they're unconscious. Don't beat yourself up and realize that acceptance is the first step to overcoming whatever notions you may have. Try to blind yourself, and I don't mean grab a piece of cloth and cover your eyes with it, but instead ignore any factors that could introduce bias. When forming an opinion, put aside trivial elements such as age, race, gender, sexuality, and disability. Most prejudices are formed because your brain has come up with a mostly negative association and stuck with it. Form new associations with positive concepts. Try new things and read and watch credible news sources and books to hinder that unconscious bias and train your brain to think more rationally and critical. Expand your thinking and don't be afraid to see from a different point of view. Most of all, just recognize where you're coming from and where you want to be. If you believe you're already halfway there. If we all want to be equal, we have to actively try. It's easy to complain and point out the problems that are going on, but the real work is attempting to fix it. We have to use our voice and our minds in order to live the life we want and help others in achieving the same. We can all do better. We have to recognize one thing though. In the end, we're all just people. As social critic and comedian George Carlin once said, men are from Earth, women are from Earth. Deal with it. Thank you.
Good afternoon, Dr. Ashby. How are you today?
How you doing, Mr. Johnson? Pleasure to be here.
I'm doing excellent, man. I'm actually extremely excited and pleased to have you here to talk with my students and faculty. So
Hey,
thank
man,
you.
it's a pleasure to be here. It's a pleasure and an honor to be here. And I don't know if your students know, but I call you the big homie, man. You helped raise me from a young kid who aspired to be a doctor, and you were one of the many people that was part of the village that supported my dream. So I'm just happy to be here.
Well, thank you so much. And I appreciate you taking the time. So you know what, we're going to go, I know you're a busy person, so we're going to jump right into it.
Yeah.
First of all, let us know a little bit about you. Tell me exactly what you do, your area of expertise, and how long you've been practicing.
All right, so I am a vascular cardiologist. And what does that mean? That means that I am a cardiologist, which is a heart doctor. And essentially I specialize in all forms of heart disease. And so to give you an example, I treat patients with heart attacks, but more importantly, I try to prevent them. But other things like heart failure or arrhythmias, which are electrical abnormalities of the heart, fall all under my domain. But in addition to that, I'm also a vascular specialist. And so I describe that as me being a glorified plumber. So I take care of the pipes. So the arteries, veins, and lymphatics. And essentially my domain, my specialty is the entire circulatory system, which consists of the heart and the blood vessels. And in terms of how I got here, as you know, I went to school. I am a proud Florida boy, born and raised. After that, I went to college at Florida State, where I got a degree in psychology. And a lot of folks don't know that you don't have to major in a science major, even though psychology is technically a science. You can major in whatever you want to and become a physician. And so if I had to do it all over again, I probably would have majored in political science or business. But that's a little important tidbit for your class. But after FSU, I went to med school at Cornell, got my medical degree there, and decided to specialize in general medicine. And so I went to Columbia University, where I got my degree or my training in internal medicine. And after that, I ended up at George Washington University, where I got my cardiology distinction, and I trained to be a cardiologist. And after that, I went to Johns Hopkins and got my training in vascular medicine. And I came back home, and now I'm back. And now I'm practicing as a vascular cardiologist.
Love it. How many years have you been working within this vascular cardiology field?
So that started back in 2014. So time flies. So I'm on year 7 almost. So time went by pretty quickly, and I love what I do. And I guess given how quickly the time has gone by, I mean, it must mean that I love it. So I'm truly blessed.
Excellent. Mm-hmm. Question: What was your motivation? Why did you become a doctor?
So it started actually at a young age. I had really bad asthma. I used to go in and out of the hospital. My mom was a respiratory therapist, and so she kind of introduced me to the field of medicine from sort of a academic standpoint, and would tell me a lot about what she does, and I found it very interesting. And so between my bad asthma and my mom being a respiratory therapist, I thought I wanted to be a pulmonologist, which is a lung doctor.
Okay.
But once I started learning more about the field of medicine and kind of getting more hands-on experiences, I decided that cardiology was where I wanted to be. And cardiology, if you don't know, is a great field, but one of the things that we treat is heart disease. More specifically, we prevent heart attacks and treat heart attacks. And that's the number one cause of death in the United States. So given that fact, it only made sense that I went into that particular area.
Absolutely. As you know, my brother suffers from major asthma. So obviously that rings a bell. So
and that's how I know you.
Exactly.
Your little brother, who is one of my best friends.
Now, I do want to ask you a question, because we are looking at medicine, and I want to look at medicine as far as through the eyes of equity, diversity, and inclusion. I want to touch on that a little bit. So, so first of all, what does that actually mean to you? What does equity and diversity mean to you? And secondly, why is it important or necessary in the field of medicine?
So great question. And you touched on some terms. You said diversity, you talked about equity, you talked about inclusion. Another term that we love to use is healthcare disparities. And so without trying to confuse everyone, essentially in a nutshell, what we found in the field of healthcare, just like in so many other areas of life in the US, the difference between Blacks and whites are huge, meaning that if you look at healthcare outcomes, such as death, if you're Black or brown, you die sooner, so your life expectancy is less. You're more likely to die from heart disease, you're more likely to die from diabetes, you're more likely to die from cancer, you're more likely to die from infections, you're more likely to die from basically all diseases across the board.
Wow.
And now that we have the pandemic, the COVID-19 pandemic, it's only replicated what we've always seen. And this is based on the history of our country. As you know, our country was founded on these great high-minded ideals, but in reality, the folks who wrote the Constitution, they were white male slave owners. And so when they put together the institutions, they built it for them, not for women, not for minorities, not for even white males that didn't own land. They built it for them. And what we're dealing with is those same institutions that were built. Luckily, we had some great patriots that help America become more, helped America achieve the ideals that were written in our Constitution and our Declaration of Independence, and stay true to its word. And now, because of that, someone like me could become a doctor. But unfortunately, just because the laws changed that prevented me from not becoming a doctor or getting an education, those institutions still exist. And because of that, we're dealing with what we call institutional racism. And as a result, it leads to poor outcomes when compared to our white brothers and sisters. And as a result, we have poor outcomes across the board. And going through training and now working at hospitals and healthcare centers, I see why. Because essentially we have a system that unfortunately excludes folks based on economics. And as you know, the poorer you are, the less likely you are to have insurance. And because of our history, if you're Black or brown, you're much less likely to have insurance. In addition to the fact, you're much less likely to have an education, you're much less likely to eat good food, you're much less likely to be in an environment without pollution. And those are things that we call social determinants of health. And all of those kind of conspire to lead to poor health outcomes. And so because of diversity, you have folks like me who are practicing medicine and are trying to address those issues, yet we still deal with these institutions that work against us in a lot of ways and tend to perpetuate a lot of the disparities that we see. And so now that we're in 2021 and we're in the middle of a pandemic, it's not over yet, but looks like things are winding down, even though SARS-CoV-2 or CoV-2 ain't going anywhere. but the pandemic may be brought to a heel. We're seeing that these institutions need to be reformed. And it's my hope by the time your students get to my age and either they're practicing medicine or they're professionals in one way or another, that they're addressing a lot of these issues. Because what really touched my heart is the fact that the younger generation seems to get it. They understand that America needs to be held accountable. And once our new leaders come to age, I'm very hopeful that things will change. So we'll see.
Excellent. Now, you touched on systematic racism, and I appreciate you talking about that a little bit.
Yeah.
But let me ask you something personally. Have
Yeah.
you ever experienced bigotry or racism as a medical professional, or while you were in school trying to become a doctor? And if so, like what did it look like, and how did you deal with that negativity and not let it get in your way?
Oh man, so where do I start? So one of the things that I've dealt with a lot of the time is stereotypes. Because of the way I look, because of the way I talk, a lot of folks assume that I wasn't intelligent. I could recall a number of circumstances or incidents that occurred during my education and training. So let me start with high school. I remember I was scheduled to take a AP exam, and I told my teacher that I was in phys ed, so I was in PE, but I had to leave to go do my exam. And I told my teacher, I said, hey, I have to leave to take my AP exam. And she told me that I wasn't smart enough to take an AP class, and told me to stop lying. So in order for me not to miss my exam, I had to beg her to call the front office to confirm that I was in fact an AP. And with no apology, she let me take my AP exam. Another example was when I told my school guidance counselor that I wanted to be a doctor. During that meeting, she looked me in my two eyeballs and told me that maybe trying to become a doctor was a little bit much, and told me to consider doing another allied health profession, such as becoming a medical assistant or physical therapy, which there's nothing wrong with those, but that's not something that I wanted to do. But she thought that was more attainable for me rather than
that wasn't your passion.
Yeah, that wasn't my passion, not at all. But again, no knock to those professions, especially physical therapy. It's very difficult to become a physical therapist, and they are doctors of physical therapy, FYI. But she tried to redirect me in a different direction. But luckily, because of folks like you, Mr. Johnson, and others, I was very confident. And so for every time I heard no, I heard 100 yeses from my family and my friends and my community. And so I never doubted myself for a second. So I just kept on chugging along, and went to college at Florida State, and luckily I was able to excel. And one of my first experiences with, I would say, discrimination, I guess, was when I was in med school. Discrimination while in my medical training was in med school, when I was on a rotation with a professor. So just to kind of paint the picture, when you're in your second year, you do so your first 2 years are generally book work, and then your last 2 years are just on the job training, which are clerkships. So during my second year, they were preparing us for clerkships. So we had like these mini clerkships where we would kind of see patients and learn some of the basics of medicine and do presentations. My professor told me during my first day that he was going to ride me like a donkey. He was an old 80-something-year-old gentleman from North Carolina. He was actually the former dean of Duke Med School, and he was retired. And he was a professor emeritus at Cornell, where I attended medical school. And I just had to let it go. And 2 weeks into the rotation, he called me to his office, And he told me that um, I was the smartest kid in the rotation. And when he first met me, he didn't think that I was that smart. And he said that he wanted to help me. And so this gentleman actually helped me and put me in acting classes so I could express myself better, so that when I was on the rounds, people wouldn't judge me the same way that he did. But
Wow.
that was kind of a reoccurring theme that I dealt with throughout med school and residency, with people subjectively assuming that I wasn't as smart as I was. And luckily, I did very well in tests, and I would frequently get the highest tests in the group or in the rotation. And that's what allowed me to do very well in med school and subsequently residency and fellowship and so on. And I ended up becoming the chief fellow of my cardiology class. And that sort of vindicated a lot of the issues that I've dealt with early on, with folks saying that I shouldn't be there. And, being the chief fellow, folks knew that I had to do something right, because you don't get it based on people wanting to achieve diversity. You get it based on merit alone.
Sure.
And so, now that I'm practicing, what I tell folks is you're going to encounter it. It's very subtle, and it's really based on perception, because a lot of times when young Black men such as myself are portrayed in the media, or they're encountered, it's usually in a negative light. And so I just try to let folks know that anything's possible, but it's important to be true to yourself.
Wow. No, I truly appreciate that. One of the things you mentioned was your kind of your support system. And
Yes.
I'm extremely happy that you had that system there of people who did believe in you, especially during those times when you were met with opposition when it came to your dreams and your pursuits. So, no, that's fantastic.
Yes, I credit my village for everything, and that's something that a lot of gentlemen don't have. And I do a lot of mentorship, and it's very sad to see the lack of support that a lot of my mentees encounter. And so I go out of my way to pay it forward and support them in any way I can. But it's very difficult when you hear a lot of negatives and no positives. So,
Right.
Message for your class: if you don't believe in yourself, nobody will.
Message.
Sure.
All right. So now I do kind of want to stay with a little bit where we talk about a little bit about maybe bigotry a little bit within the medical field. One thing that I keep hearing, whether it's from the Black women in my life, or when I pick up a couple of different medical articles, they talk about the treatment of Black women within the medical field. Even though you're not a woman, but could you maybe talk about that a little bit? And what is the disparity that they keep talking about when it comes to Black women specifically and medicine?
So it's interesting that you asked that question, because it's so apropos for this particular time, given the Meghan Markle interview. And for those of you who don't know, she is the wife of Prince Harry, who's obviously part of the royal family, or formerly part of the royal family. And she gave an interview and talked about a lot of the discrimination she encountered within the royal family, given that Meghan Markle is half Black. And so what you hear a lot in the media, what you're hearing now, is that she's overstating it. She's complaining. She's rich. Why is she depressed? Why is she suicidal? And that is very similar to what Black women in particular deal with within the healthcare system, is that their issues don't get addressed. And so, for example, someone like Serena Williams, who is a world famous athlete and super wealthy and very intelligent, she had to advocate for herself because her doctors wouldn't really appreciate what she was dealing with. To give you the story, she ended up having pulmonary embolisms, which are clots that ended up in her lungs and could have killed her. And she developed those recently after giving birth, which is a risk factor for pulmonary embolisms. And she's actually had them before, so she knew what the feeling was. And she explained this to her nurse and the healthcare team, and they just would not listen to her. They thought that she was fine and she was just exaggerating. Long story short, after begging for a CAT scan, they found that she had pulmonary embolisms, and they ended up treating her. But if she didn't advocate for herself and insist on getting the CAT scan, there's a good chance she wouldn't be around right now. And this is something that we see time and time in medicine. And it's interesting that we talk about science and objectivity, but yet we don't really appreciate it when it comes to women of color or people of color a lot of times. Because as Jay-Z said, men lie, women lie, numbers don't. And across the board, as I mentioned earlier, we do poorly in every category, essentially, and Black women in particular. And one number that stands out is the maternal mortality rate, meaning the mortality rate for Black women when they give birth. They die at a very high rate compared to their white counterparts at a number of about 3 to 1. And their numbers, their mortality numbers rival some third world countries, even third world countries. And I hate that term, by the way, but let's say underdeveloped countries or non-industrialized countries.
Gotcha.
But countries like Cuba have a better mortality rate than Black women in the U.S.
Wow.
Yet we have all of this technology, all of this wealth, all of these resources. It's unfathomable that women would be dying at a higher rate by simply giving childbirth. And that's really a reflection of our healthcare system. And there's been studies that have shown that med students, prior to entering med school, they actually are less biased towards people of color prior to getting their medical education. So after they're educated, they believe in things like Black people have a higher threshold for pain. They believe in things like Black people have thicker skin. And the reason why they learn those things or believe those things is because they learn that from their superiors or the folks that are training them. And unfortunately, those biases
The old guard.
The old guard, but it's part of the institution. And I had to actually question myself because one time I had a patient that came with some chest pain, and it was a Black dude, and I ordered a drug tox screen. Now, I have patients that come in with chest pain all the time, but because he was a Black guy, I decided to order a drug tox screen, knowing that white Americans use drugs at the same rate, if not at a higher rate than Black Americans, particularly cocaine. Okay. And so it's actually paradoxically bad for the health of my white patients, because if they're coming in with cocaine related chest pain, there's certain medications that you shouldn't give that person. And so knowing that they have cocaine in their system, I would treat them differently. But the fact that I decided to check that patient, and I've done that in the past and not other patients, was a sort of a revelation to me. And, these biases kind of creep into you subliminally, and you don't even realize that you're doing it. And that's really a kind of a microcosm for the healthcare institution, where these implicit biases are just there. And there's discrimination towards women. And you're finding out now during the Me Too movement with a lot of the sexual harassment that happens, particularly women who are training. They have to deal with all kinds of really despicable behavior from their superiors. And then on top of that, you have the issue with racial discrimination. So those are real issues.
Thank you. No, thank you for touching on that. It really broke my heart. Last year, there was, COVID, obviously during the pandemic, there was a physician. I believe she was a physician, and she filmed herself. She filmed herself in the hospital, and they would not believe her. Mm-hmm. And she ended up passing away.
Yep.
And
Dr. Susan Moore. I mean, she was a highly trained physician went to University of Michigan, one of the best med schools in the country. And as a patient, she got inferior care and she got dismissed, and the staff viewed her as a problem because of her advocacy for herself. And this is what happens time and time again for all women, but particularly Black women who assert themselves, who have the audacity to advocate for themselves and demand equality. They're viewed as hostile and being a problem. And it's a real issue, and it's kind of baked into the cake. And you know what I have to say to the young generation is, I can't curse on here, but you know, forget that, okay? And don't let anyone tell you how to behave, how to act. Particularly my young women out there. It's time for our country to change and honor the ideals that all men are created equal. That we got to get rid of that, by the way. All people are created equal, okay? And you shouldn't apologize for standing up for yourself and do just that. And people are going to knock you down and try to knock you down and try to disparage you for that. But yeah, don't listen to them. And like I said, I'm very hopeful that the younger generation will put an end to this.
Excellent. What I want to do is I want to kind of segue into COVID. Obviously, everybody wants to know about COVID. It's been official pretty much a year since, let's just say, since the schools recognized it and shut down. This was literally like our last regular week. Last year, this time, this was our last regular week before everything got shut down. So, Dr. Ashby, what exactly is COVID? And why does this disease affect communities of color harder than other communities? So
another great question. So let's be clear on some of the terminology.
Please.
So what we're talking about is the SARS-CoV-2 virus, and it's part of the coronavirus family. Okay, so the coronavirus is something that you, I, and most people have probably had. It causes a common cold. There's other viruses that cause a common cold, but there's about 3 or 4 coronavirus strains that cause a common cold, and it's usually no big deal. It's nowhere near the flu. You might get a sore throat, runny nose, but you know, you should be back on your feet in 2 or 3 days. But there's been a few strains that have come out that have been very lethal. Those were the first one was SARS-1 or SARS, which came out about maybe about 15 years ago, and then followed by MERS. And those viruses were very lethal and killed people at a much higher rate, to the tune of about 30%. And luckily, those didn't become worldwide because they weren't as transmissible, meaning they weren't as easy to catch. And part of that is that when people got it, they got very sick. And by the time they were infectious, they were super sick. So we're out and about, spreading it to one another. Now we're dealing with the SARS-CoV-2, which is a new strain that was first identified in Wuhan, China. And that virus can cause what we call COVID-19 disease. Sort of like HIV can cause AIDS, SARS-CoV-2 can cause COVID-19 disease. And so you can technically get the virus and not develop COVID-19. And COVID-19 describes the disease process that you can develop, which can be as innocuous as loss of smell to as severe as acute respiratory distress syndrome, which is basically your lungs are flooded with debris and fluid, and you're unable to oxygenate, and you need to be on a ventilator. And a lot of those patients end up passing away, unfortunately. So that's my brief lecture on SARS-CoV-2, which causes COVID-19 disease.
Thank you. So now that we know what it is, your expert opinion, what should everyone do to help combat the spread of COVID?
So great question. Now it's a great time because the vaccines are out and their effectiveness is very well established. And there's data in the trials, and now we have a lot of real world data that holds up and shows that not only are people not getting the virus, I'm sorry, not getting the infection, let me restate that. Not only people are not getting COVID-19 disease, but in addition to not getting sick, they're actually not getting asymptomatic SARS-CoV-2, meaning that they're not getting the virus, not having any symptoms, and then spreading it to someone else who could potentially get much more sick. And so that's the issue with SARS-CoV-2, is that most of the spread was with pre-symptomatic or asymptomatic spread. So when you're feeling fine, you're talking to someone, and then boom, you spread the virus to them, and before you know it, they get sick. And so once you're vaccinated, the likelihood that you'll do that is very low. So that's bringing us much closer to herd immunity, which is a concept of if enough people have an immunity to a virus, it protects everyone, even if you don't have the vaccine or immunity. And so that's what we do with other viruses. And that's why we have an entire vaccination program. So most of your students had the mumps, measles, rubella vaccines, and that's preventing them from getting that condition. But you're protecting the infants who are too young to get the vaccines, or people with immune suppression. And so that's important. But until we reach herd immunity, it's important to wear your mask when you're indoors and socially distance from one another. Now, what they won't tell you in the public health domain is that it's very hard to get the virus outside unless you're talking to somebody who's very sick in your face. So mask use outside is not that important. But again, you didn't hear from me. But when you're inside, particularly in a poorly ventilated space, that's where it's spread. And so when you're inside, wear your mask. And if you can, open the windows and let it ventilate, and keep your space from one another.
Oh man, great advice.
Keep your hands clean. And keep your hands clean. Yes.
Great advice.
That's general advice. Yeah, my pleasure.
So recently I saw something, and it said what I read was this pandemic is going to turn into an endemic. So my question is, do you believe COVID will eventually go away, or will this be something that we will have to deal with like the flu each year?
So this is something that I actually said at the onset of the pandemic, and people thought I was, kind of being an alarmist, but SARS-CoV-2 ain't going anywhere. I mean, it's too ubiquitous, and it's everywhere. So yes, it may not be a pandemic, but it will likely be endemic, meaning that it will circulate at low levels in the environment as opposed to high levels, which why we call it a pandemic. And it's precisely to the point that you mentioned. We have these variants now, and people say strains, but there's only one strain of SARS-CoV-2, but there's multiple variants due to mutations. And so we've seen that we've had a few variants in the United Kingdom and South Africa and in Brazil that has caused the virus to be more effective at spreading. So it's more infectious. But in particular, the Brazilian strain and the South African strain are actually resistant to prior immunity. But luckily, the current vaccines that are on the market work very well against it. But they're developing new modifications to the vaccines that will potentially prevent further variants down the road. But long story short, the current vaccines that are out now, you're protected. But the way that this virus seems to be mutating, it's quite possible that there will be variants that will escape the immunity that you have from the vaccine or to prior infection. So yeah, it's entirely plausible that we would have to get booster shots in the future.
Thank you. So we're almost done because I know you're a busy man. I actually have two questions from one of our science teachers, Miss Grant. Her class had a couple of questions. The first question was, what advice would you give a student that is interested in going into the medical field?
Oh, so I'm going to be very quick on this one. Listen to people that are already there. Okay. So one of the biggest mistakes that folks who want to be doctors make is that they listen to their academic advisor only. And no, they're great at what they do, but they deal with all kinds of students. and they kind of have a cookie cutter approach. The best way to learn how to become a doctor is to learn from someone who is a doctor. And so, shadowing a doctor, getting mentorship from a doctor is very important. So, that's something that I recommend for all of my my mentees, obviously, but I'm mentoring them. But for anyone that's interested in going to medicine or any field in particular, if you want to be an engineer, if you want to be a nurse, if you want to be, I don't know, entrepreneur, you have to learn from the folks that are successful at what you want to do. That's the best way to learn and the best way to not have to recreate the wheel. They can just kind of give you the blueprint. And that's exactly what I do to my mentees.
Love it. Last question from Miss Grant's class. An overall last question, actually. Are you ever scared to go to work because the lives of others are in your hand?
That's a great question. No, I am not scared. I feel honored. I love what I do, and I think there's nothing more um, fulfilling than to be there for somebody in their time of need. A lot of times when I see patients, particularly in the hospital, and they feel like they're going to die. A lot of times they might die, but once I see them and I talk to them and I do what I do, just to be able to be there for somebody and turn them around or improve their health, even in my clinic, it's the most fulfilling thing ever. And so, no, I'm not scared. Luckily, I'm trained. About a decade and a half of training has brought me to the point where I'm very comfortable at treating most diseases of the heart and blood vessels, and a lot of other things as well. Because I was a general doctor before I was a cardiologist, but no, it's actually the opposite. I am eager, I am motivated, and there's no better feeling when you have an emergency situation and all those skills and training that you've worked so long to develop kind of come to play. And so it's just like, a basketball player in the fourth quarter down by 2 with 5 seconds left, and that 3-point shot that you practice a million times in your backyard and on the court, it just kind of, it comes to you. That's how it is in medicine. I mean, those things that you do is not by chance. It's really by hard work and dedication. And so I'm just glad to be able to apply it to, people who need me most.
Dr. Bernard Ashby, once again, thank you so much. But I do want to just give you the last, I'm going to give you the floor. Do you have any parting words for my wonderful students at Falcon Cove Middle School?
Well, yeah, I mean, I think one of the reasons why you brought me on here is because of Black History, which we're a little late for, but Black History is not just a month; it's a lifestyle, and it should be every day, all day. And so, one of the things that I want to mention is that I wouldn't be here were it not for my predecessors. There's a lot of folks who sacrificed for me to be here. Not just my parents, not just my community, and believe you me, they've sacrificed a lot. But a lot of people died. A lot of people were locked up. A lot of people got chastised just so I could be here. And so I don't take that for granted at all. And so everything that I do, I try to pay homage to the folks that have come before me. And it's important that if you go into medicine, that you do so with not just a business-like approach, but it has to be your calling and a passion, because medicine, unlike other fields, deals with life and death and health and wellness every day, all day. And so you have to approach it that way. And if you want to become a doctor, but basically, if you want to become any professional, you can't cut corners. I mean, you have to do the hard work. You have to dedicate your time. And if you say that you want to do something, particularly get into a field that has a low percentage of success, you're going to have to, work hard and not fool yourself into thinking that you're going to get there simply by wanting to do that. And so it begins now. I don't care if you're in middle school or elementary, which is younger. But you have to put that work in now because it's going to pay off eventually. But what I see a lot of times is that folks say they want to do something, but they generally don't put in the hard work and dedication, and then they wonder why things don't work out for themselves. So this is a message to you guys out there. If you want it, yeah, you gotta eat, sleep, and other things to it to get it. Okay, so I'll leave it there.
Ashby, where can they catch you? You know, I see you often on television.
Yep.
So, you know, just in case they want to follow you or, you know, just continue to hear from you, where can they possibly catch you?
Yeah, I mean, I guess, yeah, I do a lot of TV, particularly news. But if you want to follow me on social media, you can check me out at B.Ashby, B.Ashby MD, actually, on Twitter, on Instagram. Also, I'm on Facebook, but I'm not that active on there. And so that's pretty much it. Eventually, I get on TikTok one of these days, but I'm also on Clubhouse, and you can find me under my name, Bernard Ashby. So I'll leave it there.
Hey, don't be too shy. You can also catch him on MSNBC, on CNN. Yes. Thank you so much, sir. I truly appreciate you, and I love you, man. Thank you.
Love you too, big homie.
We live in a world that is systematically unequal, where one group is favored over another and over another. From there, you start saying terms such as anti-Semitism and sexism, but I argue that we should really be saying discrimination. Our hate cultures become so vast and complex that we have hundreds of words to describe the inexplicable and offensive things we do to people. Our actions, no matter how small, can affect someone's life indefinitely. Millions around the globe have to ask themselves the question, will they accept me? Too many have lost their self-identity because of discouragement amongst their peers. Too many have been hurt and rejected by expressing themselves. The LGBTQ community is one of the largest groups that is not accepted in the US. But progress is being made. An overwhelming amount of America's LGBTQ adults say that 92% of society has become more accepting of them in the past decade, and an equal number expected to grow even more in the coming years. Additionally, the Biden administration promises to help this community as much as possible. The Equality Act gives these people rights on housing, employment, and public spaces. However, the fight isn't over. We all have to change the way we think. We all have to be open-minded and understand each other's perspectives if we really want to change. How do you explain 1,010 people being shot in the past year because of the police? It's simple. You can't. Racial profiling is when the police decide whether or not to arrest you based on your race, ethnicity, nationality, or religious appearance. People like George Floyd and Adama Traore suffered an unjust fate. But through all the violence and bloodshed, there has been determination and ambition. Over 9,000 peaceful Black Lives Matter protests took place across the country just between May and August last year. Author Ibram X. Kendi once wrote, "There are lazy, hardworking, wise, unwise, harmful, and harmless individuals of every race, but no racial group is better or worse than another racial group in any way." Instead of living in our racial world, let's choose to live in an equal one. In the land of immigrants, our immigration system is broken. Ironic, isn't it? Immigrants, the backbone of this nation, are greatly undermined. 17% of the US working class is comprised of immigrants, and yet our discrimination towards them has left them in poverty. Just last year, 545 children were ripped apart from their families at the US-Mexico border. Thousands of Venezuelan refugees are stuck in detention centers. for several months before they can apply for citizenship. And Muslims are continuously looked upon as terrorists when they only want to fit in. We can fight for these people though. We can protest, speak up, and continue to believe in the future of this nation. That way we can give the opportunity to others to live in our great, diverse home. So let's choose to live in a society where we are all accepted. We must realize that it is okay to be different. We all are. But at the end of the day, we must choose change. We must choose to make a difference. That way, there is no place for hate. Thank you.
Mr. Ed Narain, how are you today, sir?
I'm good, Mr. Johnson. How are you?
I'm doing extremely well. It is a privilege and an honor for me to have you here and to have this discussion with you. So thank you.
Thank you. Thank you very much for including me and inviting me. I know it's not exactly Black History Month anymore, but like I tell people all the time, Black History Month is really Black History Year, because we're very much a part of American history and world history. It's just nice to have those 28 days every year, what 28 days every 4 years, 29 in the fifth, to acknowledge all the accomplishments of African Americans, both here and abroad.
Absolutely. So essentially, what I'm doing here is I'm putting together a program, and like you said, for Black history, and like you said, does not have to be a month, 365. So we're doing a Black History Month, but we also are tying in and looking into equity, diversity, and inclusion. And so,
Nice.
Ed, do me a favor. Although I know, please introduce yourself, please. Tell people what you do, what you did.
Okay.
And, go ahead, sir.
Yeah, I'm happy to do that. So me and Mr. Johnson know each other, wow, man, over 25 years now. We met at the University of South Florida, both when we were pursuing our undergraduate degrees. At the time, I majored in psychology. I ended up going to get a master's in business later on, and eventually went to law school later on in life and became a full-fledged licensed attorney here in the state of Florida. But I think what Mr. Johnson is referencing is the fact that at one point in time, I served in the state legislature here in the state of Florida. We're representing the 61st district based in Tampa. I was also, as a freshman member, elected to be the chairman of the Florida Legislative Black Caucus, the third largest caucus in the country, where we dealt with a lot of social justice issues, police reform issues, things of that nature. Professionally, I've worked for the last 20 years for AT&T, where I'm currently a vice president in external and legislative affairs, which means I work a lot with our community and with government and elected leaders. So some people would say I lobby. I do lobby locally on issues that are important on behalf of the company, but a lot of my work is done on the policy side, where we're evaluating legislation and working to make things better for our company, but also for the communities that we live and serve in.
Excellent, thank you. Ed,
Sure.
let's jump right into it. What does equity, diversity, and inclusion mean to you? And
So that's,
and why is it necessary or important in government?
So, I've heard this really great definition recently that I've been using a lot for diversity, inclusion, and equity. A lot of us are good at the diversity and inclusion part. So diversity meaning there's a dance and you get invited to go to the dance, right? You're different than everybody else. You're there. There's diversity because of your very presence. Inclusion would be saying, hey, everybody's dancing. Would you like to dance? So you get up and you dance. So you're included in the activities that are happening at the dance. Equity, however, is a little bit different. Equity is when people say, hey, Rich, Mr. Johnson, what type of music do you like? Because we're going to play what you like next. So in other words, equity is when we say we're going to give you an opportunity to also participate in the decision-making process. So, just to give you a simple analogy, diversity is being asked to dance, inclusion is being asked to dance, and then equity is being asked what type of music you would like to hear also while people are playing their music too. So it's kind of leveling out the playing field to some extent.
All right,
What do you think of that definition? I loved it.
I love the analogy. So now why is that important in government or in politics?
in politics and in government, it's really important because obviously, unless you know the perspectives of a group of people where they live, a certain community, it's very hard to advocate for the needs of that community. So when you talk about having a diverse legislature, for example, when I was chairman 5 years ago, we had 27 members of the Black Caucus, which meant we had 27 people who represented different areas of Florida that happened to be of African descent. And so we all know that our communities have different issues than traditional communities for any number of reasons that we could get into, but you need to have individuals who come from those communities to voice that. It's very hard to explain what's happening in somebody else's home if you're never there.
Thank you.
Mhm.
Why did you become a politician, or what was your motivation?
So my motivation at the time was to really, I just didn't like the way things were happening in my community. I didn't feel like we were being represented very well. And I saw President Obama get elected in 2008, which kind of rekindled the fire that I had buried inside of me. When Rich and I were at school together, I was president of the student body, and my running mate at the time was also African American. It was the first time at a PWI that had ever happened. Unfortunately, some 20 plus years later, it's the only time it's happened in our state's history where you've had a Black president and a Black vice president at a white institution. Hopefully we'll see that change soon, because I hate, I like that we made history, but I hate that we're still a part of that history. But I stayed away from politics for a long time, would just watch it, contribute to candidates, work on campaigns, do different things to help people get elected, but didn't seek office myself. And then it was right after the whole Trayvon Martin situation really came to a head, and a seat was opening up in the legislature. I was still finishing up law school, and people kept saying, you need to run for office. In particular, my former boss, one day over a lunch conversation, said, you should run for office. And I took that as a sign that maybe I should, step back into politics again. It was a tough race, but my team was tougher, and we won. And I like to think we did some really good things while we were in office that made the community better.
How long were you elected to that position?
I was in the role for 2 years and one term in the legislature, where we got a lot of stuff done. We passed 7 pieces of legislation, and we brought millions of dollars home to our community. Some kids may want to take time to research the Dozier School for Boys. That was legislation that myself and Senator Ardenia Joyner worked on to help those families who lost loved ones in that entire situation, which is a really dark stain on our state. The other thing I'm really proud about is in a couple of months, we're going to unveil Mary McLeod Bethune at National Statutory Hall in DC to represent the state of Florida.
Wow.
I, along with Jose Diaz, passed legislation back in 2016 to take down the Confederate general that was representing the state of Florida in Washington, DC. So if you can imagine, in Statutory Hall, every state has 2 representatives that are significant to their state. Well, in Florida, we had Dr. Gorey, who was the inventor of air conditioning. Being Floridians, we should all be happy for that. And then we had a Confederate general, Edmund Kirby Smith, and his only claim to fame in Florida was that he was born in the state. That's it. No other ties to Florida. So if you look at history, you'll see that right around the 1900s, a lot of Confederate statutes started going up again all across the South, some 35, 55 years after the end of the Civil War. And it wasn't a commemorative thing. It was a nod to Black people that the South was going to rise again. And it coincided with a lot of lynchings in the country. And so that statute was put up in DC. And when we found out about it, we wanted to get it taken down, so we took legislative action.
Excellent, thank you. Ed, did you have a mentor when you were going through your process, or maybe during schooling?
I did. That's a great question. I had quite a few mentors. It just depends. Obviously, my father is my original mentor, and still continues to guide me through all kinds of stuff. Dealing with my family and manhood and decision making. At work, I mentioned my former boss, Jack Keneally, who unfortunately passed away just 2 years ago, but he was a great mentor for me at work. And then politically, and I would say also in our fraternity, Les Miller has been a great mentor for me. I mentioned being president of the student body back in 1997. Wow. He was the first Black student body president back in 1977.
Right.
So, I jokingly always say to him, it seems like I'm following him in a lot of ways, because he was in the legislature starting in 92, and then I came along, in 2014, right behind him. So, I did have a mentor. I think they're important. I also think in the business world, the professional world, you need to have an advocate, someone who is always trying to sing your praises and help you get to the next level. But you definitely have to have a mentor, and that mentor needs to be somebody who's kind of been through what you've been through, so they can help you navigate through it. When you think the sky is falling and you're like, oh my gosh, I can't pass this class. And somebody comes along and says, yeah, I felt like you felt, but let me show you what I did. And this is how I was able to pass it. That would be the ideal mentor.
Excellent. Thank you.
Of course.
Now we're going to touch on it a little bit.
Sure.
Have you currently experienced, or in the past experienced, bigotry or racism in your professional politics?
Oh man, easily. I could, if I sat here and talked about microaggressions, right? But every time somebody says, "Oh, you speak so well," it's almost like, well, what did you expect me to sound like? Those are the little microaggressions that I talk about. But open, like bigotry, my first night in the legislature with Representative Bobby DuBose out of Fort Lauderdale, there where you are. We were leaving a hotel early. We had committee the next morning. We ran into a couple of members. One of the members looked at us and said, "Wow, you two fine gentlemen, you're so well. Who do you work for?" And I looked at him. I was like, "What do you mean, who do I work for? I've got the same pin on my shirt that you do." And he's like, "Oh, I'm so sorry." What was really bad about that was that he had done our training a week before, so he definitely should have known who we were. Well, long story short, we were having a continued conversation, and I jokingly said that we would join the Republican Party if he would have made sure that an African American would be a speaker for the first time in Florida's history, and he dropped the N-bomb. Needless to say, yeah, he dropped that word, and somebody grabbed him and moved him off. There is no defense. He had a couple of drinks, but he was cogent enough to have a reasonable conversation with us. So that just says, a lot of times the Bible says what's in your heart comes out of your mouth. And that's what happened in his case. So, that's my first introduction to the legislature that night, is having, a white member basically say, "You N-words already have a Black president. Now you want to be speaker." That was the exact quote. Yeah.
A1.
Day one, night one.
How do you, obviously you're a professional. I know this about you, but how do you deal with that kind of negativity and not let it get in your way?
So, I was telling some friends the other day, I think we waste too much time worrying about haters and what other people think, right? Who really cares? They're not putting food on your table. They're not paying your bills. They're not helping you raise money. They're not helping you pass your class, not taking the test for you. They're not studying with you. Like, I'm not stunting for anybody, is what I say. At the end of the day, it really doesn't matter. And I'm not entitled to know what people think about me either, right? That's their opinion. Who cares? What really matters is what I know about myself, what I think about myself, what my wife, my parents, and my children think about me. Their opinions are the ones that matter. So when I think about like ignorant, racist people, I kind of don't. Because if I sat there and wasted my energy worrying about what they thought, I wouldn't get anything done. So I always encourage people to just focus on whatever it is you're trying to do. And believe you me, if you have haters, that means you're doing a good job. I think everybody should want an audience, right? And like I told this friend, I was like, who doesn't want to have a front row seat? So I'll give my haters a front row seat to my success. What can they do? They can't stop me unless I let them, and I won't.
I love that answer. Brother Narain, it looks like we have somebody in the waiting room.
Oh yeah,
Brother Bobby DuBose.
Oh, let him in.
I'm gonna let him in. This is a big surprise. Good evening. Oh, it's actually connecting. So this is This is a first for me. Brother Bobby.
Hey, what's going on?
We got the Democratic leader of the state of Florida.
Bro,
The minority leader, Bobby DuBose, is joining the recording here for the kids. I love it. Thank you, Leader DuBose, for taking time out of your schedule to join us. You got any words of advice for us?
I'm sorry, I'm jumping on where we at in the program. Bring me up to speed.
Well, I just told the story of our first night in the legislature where an individual dropped the N-bomb, but wasn't that a wild a welcome to the legislature?
Well, I mean, it was a welcome, and in hindsight, when I think about it, we probably shouldn't be too surprised. I mean, it's just that whole, living in two Americas, and we deal with things of that nature, but. You're right, Ed. At the time, it was a shocker because you think, hey, I'm a part of something bigger than self that's going to affect, 20 plus million people. And for someone that's your now colleague and equal to use such a derogatory term was shocking.
Yeah. But I'm really proud. I didn't get a chance to say this, but I mean, I'm really proud of you. Bobby and I came in together. He has a much longer history in government than I do because Representative DuBose was a city commissioner in Fort Lauderdale, right? And then ran for the legislature. And by virtue of his hard work, is now been selected by his peers to lead the Democratic caucus. I mentioned the Dozier bill that I worked on. I also mentioned the Mary Cloud Bethune statute that's coming up as a result of the work that Pepe and I did. Last year, you passed some really important legislation when it came to the Groveland Four. And some of Mr. Johnson's kids are learning about Black history. Can you tell us real quick about Groveland and the Groveland Four and what that bill was about?
So the Groveland Four is about four young Black men who were falsely accused. Every time I tell a story, as old as the Groveland story is, it's still kind of modern day, but it's a tale, unfortunately, that has such a long history. Probably the Emmett Till is another example, but four young Black men who were wrongfully accused by a white woman, and just kind of summation, they were falsely accused. Two of them were killed. And so what has been an effort was to have these four young men exonerated. And so what could have gone through a process through the executive branch, we had to bring through the legislature and pass a resolution. And so basically what we did was we passed a resolution which allowed the state of Florida to not only acknowledge the wrong, but actually issue an apology to the descendants of the Groveland Four. And so that triggered action that our current Commissioner of Agriculture, when she got elected, got the executive branch. And so they issued a pardon. And a pardon is somewhat of
it's bittersweet.
Yeah, and I'm trying to explain it, trying to simplify it. So basically it's being excused or almost acknowledging you did something and being excused for it. Whereas, and the reason why I say that is because there's still an effort behind the Groveland Four to have them exonerated.
Right.
Saying, listen, the state was wrong. So it's not that we're excusing you for something you did. We're saying we're wrong because you didn't do any wrong.
That's correct.
And so hopefully I'll try to simplify that. So there's still an effort behind the Groveland Four. But here's what I will kind of tie a bow on is that although the Groveland Four is something that happened in Florida, these incidents occurred all across this country. And there were many Groveland Four incidents. And, we bring it to modern times, and we still have incidents of individuals and, what happened, a white woman lied and black men die. Probably most recent incident that is a clear example was what happened in Central Park. I know, Ed, you're in New York,
Oh
and
man, yeah.
caught on home. And there was a white woman who was lying and calling the police. And you can only imagine, but for technology, this man, this black male, could have lost his life. So our history is just, I mean, there's so many examples of this same fact pattern, and we see it over and over and over again. Um, Unfortunately. So that was Groveland 4,
Nice.
which is important to Black history, to
Yeah,
our.
it's significant, Bobby. What you were able to do with that legislation. When you put that in line, I mean, there's a lot of things that the state probably could make right and should be working to make right. But I think we'd be taking every legislative session for the next few years trying to do that. But let me pivot for a second and ask you a question, because earlier I was telling the viewers about my undergraduate history when I was student body president at USF and how I made history. You went to the University of Florida. I'm not going to big that up, but while you were there, you were in leadership as well. Tell everybody about your leadership and the roles that you had at the university, because I think it's important for young people to know that you didn't just wake up and become an elected official.
No, not at all. My journey's pretty interesting. I'm gonna take you back before UF, because my grandfather, I don't know, maybe he says I was 9, but somewhere around there, my grandfather told me that he wanted me to be a politician. I don't know if, because, I like to debate. I don't know what it was. And I remember telling my grandfather, I said, absolutely not. I will not become a politician. And so I tell people, be careful what you speak into young people's life. There's life and death and the power of the tongue. And so it started for me back home in my community. I was president of our NAACP Youth Council. And then I went to the University of Florida. I was the first person in my family to attend college. And while I was at UF, I did a couple of things, but one of them was I was vice president of student government, and that just kind of, I don't know, continue what I was doing. So I went back home and I got engaged again, and that's when I moved back to the very same community I grew up in.
What's the zip code again?
It's the 33311. 33311. I'm from the city. I live in the city. A lot of people call it the hood. I call it the neighborhood because it's changing rapidly. Unfortunately, as my hood, as folks would say, it's starting to look less like me in an area I grew up in. And so I ran and I got elected and served as a city commissioner for 6 years. It's interesting when we were celebrating the centennial of the city of Fort Lauderdale and reflecting on the history, and I looked at the political history, a couple of things stood out to me. I was only the 3rd Black person to be elected as the commissioner in the city of Fort Lauderdale. And we have never elected a Black female in the commission. So, it's just interesting in this day and age that we're still doing the first anything.
Yep.
And then from there was a void in leadership in Tallahassee, and I just knew the significance of our state representation. We did a major infrastructure within the 6th Trunk corridor, about $6 million. And a lot of that happened because of my partnership with my state senator, my state rep. And so I decided to run in 2014. And that's when Ed and I got elected up here. And I don't know how much Ed shared with you, but I'm going to kick the ball back over to him, because when he got here, he not only worked on some amazing legislation, but as a freshman, he became the chair of the Black Caucus. And that's huge. I mean, just getting here and being a part of this, and it's moving so fast, and trying to just manage it. Mind you, I had local elected experience, and Ed was just coming on the leadership that he had, acquired at college and so forth. And not only did he do well in the legislative process, but he served us as a great chair. And I'm still here, and I will tell you, he was a great chair. And some of the things that we accomplished, and on that vein, I don't know if he shared with you all, when we had some legislation that they wanted to enact around stand your ground, that whole piece with Trayvon Martin and so forth. But I won't take that thunder, because he led us, and it was a good time for us.
No, it's funny.
Let me jump in a little bit.
Yes, absolutely.
Pardon me. So, Bobby DeBose, quick question.
Yes, sir.
Why is it, and you kind of, this was a good segue, I think, because you kind of touched on this a little bit. Why is it important to have politicians or people who make decisions in government that look like you or understand you?
Oh man, so this body here that I'm in, there's 120 of us. And at the end of the day, when you're making decisions, you can only bring your life experience to the table. And when we're shaping policy, and if you're not at the table, you're not represented. And so it's so important for people to look like us, because we have a different experience. And we see that now, just with so many different things going on, but people are conscious of it. But Black folks live in two Americas. That's what I tell people. And the way we process things and the way we experience things are completely different from, our non-Black and brown brothers and sisters. And so they can only shape policy on what they know and what they've experienced. So if we are not at the table, there's no representation of what we deal with. There's no understanding of what we need. At the end of the day, we all want the same thing, but the reality of it is, racism exists, institutional racism, implicit bias, all those things are there. But if you've never experienced it, you can't shape policy to affect it or to put things in place to prevent it. So it is super important that people that look like us are at the table so they can advocate for us.
So, remember the old expression, if you're not at the table, you're on the table.
You're on the menu.
That's right.
Yeah, no, you're right.
So now, either of you could touch on this. So I want to talk about voting a little bit, and why it's so important to vote in local elections. Everybody talks about presidential elections, especially considering we just went through that cycle. But why is local elections also important?
Can I snag that one?
Yeah, go ahead.
So coming from local government, and I tell people all the time, local government is the closest to the people, right? And so you got to think about things as simple as your garbage being collected. And it doesn't sound like a big deal until no one's picking up your garbage. Not only does it smell, it becomes unhealthy. And, that's how diseases and so forth can be spread. So the local government is the government that's the closest to you. So that's one. The other thing is that for many, that's like a training ground, or folks kind of get their start, and you can really get a look at how these people are going to perform and represent you before you send them off to a quote unquote bigger office, right? And so it's so important that you have local government, because the things that we do in Tallahassee or on the federal level, to be honest, sometimes those policies, you may not feel them. But on your local government, if they pass a law say, we're talking to young folks, if your local government pass a law to put a curfew on, you're gonna feel that right away.
Yep.
Or if your local government decides to build a new park, you're gonna feel that right away, or not repair roads. Those things are gonna affect you, you're gonna feel them. And their policies are more designed, because being elected is providing services, they're designed to affect your community. And so it's super important, and talk about local government. I come from that, but I'm super proud of Broward. We call Broward, we say welcome to Wakanda, because locally we got out, and Mr. Johnson, we did what you were referring to earlier. We elected folks that look like us. And so it's very important. And so we can talk about policies. We got a state attorney who's a Black male who understands that system. So when he's making decisions, we got a public defender that's a Black man. So when he's effectively at the table and shaping policy, he knows the immediate impact. He knows what it means and the effect of. And it's not someone trying to explain it to him. So we have a Black sheriff. We have a Black supervisor of election. So we got some more, but I'll stop there.
Look at Broward County trying to come up. No, Rich, I'll just say everything